Welcome back our fans. Prognosis of periodontal lesion. 4. Anatomic factors. A. Short and tapered roots. Relatively large crowns. Prognosis is less favorable. Disproportionate crown to root ratio and the reduced root surface available for periodontal support. The periodontium may be more susceptible to injury by occlusal forces. B. Cervical enamel projections. C. Enamel pearls. D. Bifurcation ridges. Interferes with the attachment apparatus. May prevent regenerative procedures' maximum potential. Negative effect on the prognosis for an individual tooth. E. Root concavities. Difficult for the patient to clean. Decrease the efficiency of SRP, although F. Developmental grooves. G. Root proximity. Accessibility problems. The presence of furcation involvement does not automatically indicate a hopeless prognosis. However, there is difficulty of access to the area, both for plaque removal by the patient and for SRP. In 58% of maxillary and mandibular first molars, the furcation entrance diameter is narrower than the width of conventional periodontal curettes. H. F. Furcation involvement. Mobility grade I offer the best prognosis. Mobility grade 2 offer good prognosis with reconstructive surgery. Mobility grade 3 hopeless prognosis. I. Mobility. Depending on the cause, mobility may be correctable. Loss of alveolar bone. Inflammatory changes in the periodontium. Trauma from occlusion. J. Caries. In teeth mutilated by extensive caries, the feasibility of adequate restoration and endodontic therapy should be considered before undertaking periodontal treatment. K. Non-vital teeth. The periodontal prognosis of treated non-vital teeth is not different from that of vital teeth. L. Root resorption. Extensive idiopathic root resorption jeopardizes the stability of teeth and adversely affects the response to periodontal treatment. 4 prosthetic and restorative factors. A. Teeth adjacent to edentulous areas. Teeth that serve as abutments are subjected to increased functional demands. So more rigid standards are required when evaluating the prognosis of teeth adjacent to edentulous areas. Special oral hygiene measures must be instituted in these areas. B. Strategic value of teeth. Extraction of periodontally involved bicuspid and molar implant replacement of both teeth. Affect the overall prognosis for prosthetic rehabilitation. Saving or losing a key tooth may determine whether other teeth are saved or extracted or whether the prosthesis is fixed or removable. Mucogingival problems caused by lack of attached gingiva. Location of the bottom of the pocket apical to the mucogingival junction. Have bad prognosis unless it is properly treated surgically. Mucogingival problems. Clinical application. Excellent prognosis. No bone loss. Excellent gingival condition. Adequate patient cooperation. Good prognosis. Adequate remaining bone support. Adequate possibilities to control etiologic factors. Adequate patient cooperation. Fair prognosis. Less than adequate remaining bone support. Some tooth mobility. Grade I furcation involvement. Adequate maintenance possible. Acceptable patient cooperation. Poor prognosis. Moderate to advanced bone loss. Tooth mobility. Grade 1 and 2 furcation involvement. Difficult to maintain areas and or doubtful patient compliance. Questionable prognosis. Advanced bone loss. Grade 2 and 3 furcation involvements, tooth mobility. Inaccessible areas. 1. Advanced circumferential bone loss, remaining bone 30% around the apex. 2. Bone loss beyond the apex. 3. Furcation involvement with little interradicular bone. 4. Severe mobility. 5. Cracked tooth syndrome if crack extends to the root. Identification of hopelessly involved teeth. 6. Malposed tooth that cannot be corrected by orthodontic treatment. 7. Endodontic periodontal lesion if the tooth cannot be endodontically treated, i.e. calcified canals, external resorption, inaccessible. Perforation. 8. Unrestorable tooth due to severe carious lesion. 9. Unrestorable tooth due to vertical fracture. 10. Number and position of remaining teeth preclude prosthetic appliance. Due to the dynamic nature of patients and periodontal disease, prognosis must be re-evaluated during all phases of treatment. Thanks for watching. Support us by likes and subscribes.